Hello and welcome to From the Floor on our conference channel. As my team and I walked around the exhibit floor at the Health 2022 conference, I realized two things. Many health IT professionals could not make it this year because of travel restrictions, busy schedules, and other reasons. And many excellent healthcare solutions were ready and willing to help propel healthcare forward. So here we are from the floor for you to see what you may have missed. Right. So we try to have short conversations with each of the people in the booth and revealed what their solution was, what kind of problem they were trying to solve in healthcare, and the subsequent solutions to those problems. So we hope you enjoy this new series. We're trying it out at the health conference. If it works out, we will continue to do it into next year. Special thanks to our conference sponsors: Sirius Healthcare, VMware, Transcarent, Press Ganey, Sempris, and Veritas, for choosing to invest in our mission to develop the next generation of health leaders. And now to the floor.
Hi, my name is Zakraisek. I'm the Senior Market VP in Sales for Navitus Health Solutions.
My name is Hattendorf. I'm a National Accounts Market Sales Vice President for Navitus Health Solutions.
Awesome. And what does Navitus do?
We're a pharmacy benefit management company, but we're different than some of our competitors in that we really focus on the ability to be able to be very transparent and pass through. And so we're a positive disruptor model in the industry. Quite honestly, where we align very well with health systems.
And I'll just add, we're a 100% pass-through business model, and we're aligned with plan sponsors fully. We focus on helping human beings. We help them make their lives better.
So what is the problem you're trying to solve in healthcare?
It's really reducing the cost of healthcare, really at the patient level.
Who would you guys like to speak to at a health system, and what is the conversation that you want to have with them?
We'd like to speak to staff members and executives at the health system, whether it's at the finance level, the benefits human resource level, or the medical management and pharmacy level. So it's really the entire enterprise-wide is our focus with health systems. So it's multifaceted.
It's interesting. So we've got over 100 health systems that are currently clients of ours. They range in size. But it's interesting because you always have the VP, finance, benefits side that are part of the equation, as well as the pharmacy ops folks, which in many cases, a lot of the health systems have their own pharmacy assets. And we help drive more volume into those pharmacies that are owned by the health system.
I'll just add, we're a partner to health systems. And pharmacy benefit managers have evolved to the point where it feels like the plan sponsor works for the PBM. And so it's been misaligned and shifted from when it started 30 years ago. We see health systems using us as a partner to help health systems meet their goals. If a health system meets their goals, we win as a partner. It's as simple as that.
Last thing, are there any use cases that you'd like to share with our audience?
I'll speak to one. It's a university health system in the Intermountain region. It's got about 20,000 employees, and they are a health plan for the employee plan. And they have aspirations to take it to the managed care space as well, through their ACO and through their own health plan. They use Navitus as a partner to support their own pharmacies. Some of their pharmacies do the mail order maintenance drugs, and some of the pharmacies do the specialty infusion drugs. And so they've hired Navitus to fully support what they're trying to do, and that's optimize their own pharmacies.
I've got one as well I'll share. This is a health system, about 60,000 lives, owns about a dozen pharmacies, and when we were brought in, they were just departing from a 20-year-long relationship with one of the big three. And they had considerations regarding not having visibility to all the financials. They didn't see that there was aligned interest. Clearly, one of their goals was to drive more specialty drug utilization into their own pharmacies. And since we're specialty pharmacy agnostic, we didn't have a problem with that. So again, aligned incentives with our customers really just makes for a good partnership, just like Erik said.
Yeah, I mean, the only thing I'll add is we're working on let's just say over 20 health systems that are talking to Navitus. And the cost savings ranges from about 5% savings on total pharmacy spend to 30%. The average is about 18% savings. So when you're talking about multi-millions of dollars to spend, in some cases $100 million to spend, to save $18 million, the CEO is looking at us as well. And our focus is really on the members and the human beings. So the benefits team is mission critical as well.
My name's Erik. Abel. I'm with Caption Health. Also, part of our group is Caption Care. I'm our VP of Clinical Strategy and Innovation, but what we do is bring ultrasound to the masses for cardiac disease detection. So we are the only FDA cleared device out there for any medical professional to use as guidance to be able to take up to 10 standard images of the heart, and for those to be evaluated, along with coupling that with additional interpretation by AI or making the images overall available to cardiologists for evaluation.
And what is the problem you're trying to solve in healthcare?
Early disease detection in general. I mean, we are starting with the heart, but we're not stopping there. We are actually moving into lung ultrasound along with a number of other things. So I think that uniquely we're one of the solutions. What really gets me is everybody can win with ours. It's a helping population health efforts from a payer or provider, helping a patient get connected to care earlier, and actually doing it in a cost-effective manner and bringing access to them. Through Caption Care, we have a 50-state network of professionals. So in the world today with healthcare staffing shortages, we can bring that staffing to you too to help get those. We have a network of cardiologist readers. If you don't have those, we can help that out, whether that's for payer, a primary care office, or otherwise. And so our goal is to help the patients, but help the system, and let's advance heart failure well beyond where it's ever been.
And who at a health system would you like to talk to, and what is the conversation you would have with them?
I think the beginning part is folks who are actually really trying to address shortages in access to diagnostics. You know, like how can you actually do the right size of a diagnostic study for a patient? So folks that are growing a TAVR program, those who are looking at disease management for hypertension and or heart failure, growing their heart failure early management. But I think the other part that we really would like to get connected to is also providers and IDNs that really trying to have full population health networks that really do the fully connected care.
And are there any use cases you'd like to share with us?
I think the use cases I think are square. You know, thinking heart, there's a number of patients. Cardiologists think of stage A heart as one dimension, but ultimately that comes into a number of chronic conditions like CKD, hypertension, diabetes, plethora of them. And a lot of those are treated in their vacuum in a silo, right? All of those are feeders into development of advanced disease and ultimately heart failure, valvular disease. And so what we like to do is actually how can we help the system detect that earlier before and get them managed with lower cost therapies before they get into management issues, where a third of actually heart failure diagnoses happen in the walls of the hospital. And we know that based on evidence, 50% of those actually had symptoms the 6 months prior. How could we change that? And how can we help patients get connected to better therapies and escalate those sooner?
Hi, I'm Bruce Brandis. I'm president of CareAI.
And what does CareAI do?
CareAI is a technology company that is bringing ambient intelligence to healthcare to create smart care facilities.
And what do you do for health systems, specifically healthcare providers?
It has never been harder to operate and run a hospital system, recognizing two really existential challenges. One is it's increasingly humanly impossible for our caregivers to do what's being asked of them. And secondly, the fundamental models of how we deliver care are fiscally unsustainable. And we bring technology to the table that enables those challenges to be addressed by bringing technology to support our caregivers so they can improve quality, improve safety, improve compliance, and do the things that they were actually trained to do rather than turning their back on a patient to enter into an EMR or other technology that's actually made their lives harder, not easier.
So who in a healthcare system would you like to talk to, and what is the conversation you'd like to have with them?
Generally, we hear from health systems at two levels. One, sometimes is the Chief Transformation Officer, Chief Innovation Officer, who are looking more broadly at what should care look like in the future. And then sometimes we start very specifically with clinical leadership, Chief Nursing Officer, Chief Medical Officer, Chief Clinical Officer, that are looking at creating new models of care, trying to figure out how do we deal with our workforce challenges, how do we look at all of the agency spend that we're incurring that's crushing our bottom line, and how do we find new ways to deliver care in a way that's actually working with our caregivers so that they can provide the best possible care as opposed to technology that's getting in the way. And so generally one of those two, so innovation looking more broadly, or actually care leadership looking for solutions.
I'm Pittock, I'm CEO of Smart Meter, and we are the leading supplier of cellular-enabled outpatient monitoring devices and data. Bill.
I'm Bill Bassett, I'm the Chief Marketing Officer for Smart Meter.
Beautiful. And what is the problem that you are trying to solve in healthcare?
So we are helping this very large and growing outpatient monitoring industry take better care of patients by providing them with reliable devices and 100% uptime on data, getting from patients' homes back to clinicians 100% of the time.
And who at the health systems would you like to talk to? And what is the conversation you'd like to have with them?
We really look at working with health systems who are really interested in putting our RPM program in place, which could include CXOs, CIOs, CMOs, directors of nursing, outpatient programs. It really depends on the system and where they want to see the transition put in place as they transition patients out of the acute facility into home and give them the tools they need to really manage those patients in our normal patients.
Awesome. And then the last question is, do you have any use cases you'd like to share?
Oh my gosh, so many use cases. So we help hundreds of thousands of patients across the country manage their health at home. And we do that through a network of provider organizations, through over 450 distribution partners who are taking good care of the physician practices and the hospitals and providers. So our job is to supply the devices and the data that makes the whole thing happen.
What a great group of healthcare partners. We want to thank them for spending some time with us on the floor and sharing their aspirations, their solutions for healthcare IT. I want to thank them for talking to me and talking to Holly and talking to our team on the floor. We also want to thank our conference sponsors who are investing in our mission to develop the next generation of health leaders. They are Sirius Healthcare, a CDW company, VMware, Transcarent, Press Ganey, Sempris, and Veritas. Thanks for listening. That's all for now.